Good afternoon, everyone, and thank you for being here today. We've received a lot of inquiries from the community and from the media asking us particularly about the Nassau community, the Nassau University Medical Center, what's happening with the flu here in Nassau County. I know there was some reports in the media regarding an increase in flu cases, particularly in one area affecting a school where they had somewhere in the neighborhood about 50 cases within that one school. And so the media has been calling, and we thought we'd just give you a little update about what's happening here. Nassau University Medical Center is the major public safety hospital here in Nassau County with the level 1 trauma center. So we see our fair share of cases here through the emergency departments. And we have been seeing a little uptick in the flu cases here in the hospital. The emergency department has been seeing both adult and pediatric cases of flu presenting to them. Of them, they've been mostly self-limited, although there were 5 admissions that occurred over the last week for flu-like illnesses associated with other comorbid facts like asthma or some other medical condition. What we're doing in the emergency department now is to segregate patients when they come in. Immediately when they arrive to the waiting room, if they have flu-like symptoms, we immediately bring them into an area to be seen by a practitioner, a physician or PA or nurse practitioner immediately to determine whether or not the symptoms are severe. Most cases, like I said, are self-limited and are usually treated with bed rest, fluids, and antipyretics for discomfort. And usually the symptoms resolve themselves within a short period of time, and very few of them require admission to the hospital. So we had a discussion with Larry Eisenstein. He's the Commissioner of Health here in Nassau County, who unfortunately couldn't be here just now, to describe this issue that's going on here, this increased flu. And we have our infectious disease expert, Dr. Janice Furley, and she can give us a few words about what's happening currently with the strain of flu and the vaccine that we have been given. Dr. Furley? Sure. My name is Dr. Victor Politi, Politi. I'm the president and CEO of Nassau University Medical Center here in East Meadow.
We've gotten some updated information from the Centers for Disease Control, and they've indicated that this strain of influenza that is most prevalent in the community now is the H3N2 strain. People are always concerned about whether or not the strain in the community is well covered by the vaccine. And what they've indicated to us is that there has been some drift between last year and this year, so that a significant percentage of the strain of H3N2 in the community is not covered by the vaccine strain. However, the recommendation is still to recommend using the vaccine because there can be some protection, some cross-protection from taking the vaccine against influenza. So the symptoms may be less severe, and overall, patients may do better. So there's still the recommendation for people to be vaccinated, as well as, of course, there are other strains in the vaccine that would provide coverage to strains in the community.
So, thank you. I think so what we would agree upon is all of us to take the vaccine. If you have not gotten the vaccine as of yet, we recommend getting the vaccine. And if you do feel flu-like illnesses and symptoms, that you should stay home. Don't go to work or school. Call your practitioner, call your physician or your primary care practitioner to get some advice as to what to do based on your symptoms and your history, whether or not they want to see you or not in the office, and to give you what treatment might be needed. But the 2 most important things you could do is take the vaccine or receive the vaccine, and to wash your hands. Hand washing is probably the #1 thing that you could do throughout the course of the day to prevent from cross-contamination. So we have Dr. Kumar here. He's the head of pediatrics for our emergency department, and I'll have Dr. Kumar talk to you a little bit about what's happening with the pediatric population here at Nassau University Medical Center's emergency department. Dr. Kumar, why don't you say a few words?
In the Long Island, especially in the Nassau University Medical Center, we are not seeing that much of the activity of flu, what we are seeing in the rest of the country. There's definitely increase of the flu cases in our emergency room. A few steps we have taken in the hospital, especially with the help of Dr. Politi. Anytime we see a sick child who's coming down the fever, cold, cough, runny nose, vomiting, diarrhea, any symptoms, seen by nurse and right away put in the isolation room, one of the room in the emergency room, and the doctor is seeing the patient and discharging the patient within a reasonable period of time so that we can avoid the contact of that very patient with the rest of the patients. And we closely watching the flu activity in the children, especially the children who got us chronic illnesses like asthma, diabetes, or cystic fibrosis, something like that. I'm open for any questions you might have.
Of the
Thank you.
5 admissions, were they all children or were there a mixture? Or can you give me a breakdown of the 5 admissions we had?
Okay. They were all, I will ask Dr. Worley to talk about that.
The last 5 cases were identified during the last week, from last week to this week. So out of those 5, 2 were ages of a pediatric, 0 to 49 days. The other one is 2 of them were in the early childhood, and 1 of them is an adult patient, age 21. So more of the pediatric population.
How concerned are you that, for anybody, that the strain is not necessarily matched up well with the vaccination this year?
Yeah, explain that, how there was a mutation.
Well, this is a virus that is known to have drift and changes. So this is known to occur, and again, this is not an unusual thing for the flu vaccine. I think, as we've said, there is some cross protection, and so I think it's important for people to realize that this is only one of the components of the flu vaccine, and we're still very early in the flu season. So I think we're yet to see exactly how the flu season will play out in terms of other strains, et cetera. And I think it is important, and it is still recommended that people get the flu vaccine, which will cover for the strains that are there and provide, cross protection for potentially other variants and strains.
Is it possible
Yes.
that because the match is not great this year, that there could be a pandemic or epidemic?
I think the issues of match have to do with symptoms that we may see, and certainly we could see more cases. I think this is why we're trying to provide information early to people that if they have flu symptoms, they should stay, home, practice good hand hygiene, get vaccinated. These are the kinds of things that will prevent spread of the flu overall. Again, we are really very early yet, and I think we'll have to see how the strain and the numbers play out over time.
How would you characterize the spread of the flu locally here so far in past years?
I think, as you've heard, from our doctors in the ED, we're seeing some uptick in activity, maybe not as much as they're seeing in other parts of the United States, but we'll have to see how things go along. We certainly expect that over time we will be seeing more cases.
And one more question. I spoke with someone who said that they went to get the flu shot, but they had run out wherever they went. They got the flu mist. Is the flu mist effective?
Yes, it's another type of vaccine, so it can be given as an inhalation spray or it can be given as an injection. And it really, some cases, it's dependent on the person providing the vaccine, what's the indicated type of vaccine to be given.
There were some reports about one district having 50-plus cases in one school. How concerning is that it could, snowball?
Well, I mean, in any situation where you see an outbreak and a lot of spread of an infection, it is concerning. I'm sure that, public health will be involved in looking. Whenever we see this, we want to make sure and try to identify closely what exactly is the underlying issue and what's going on. I think there are different ways that they can try to handle it. Education of the people in that area will be important, and certainly for that area and Nassau County in general, it's going to be important for people to realize that we are at the start of a flu season, that it could be a significant flu season, and again, to take the precautions that Dr. Politi and we've already said. Yes.
Is there a concern that there may be a lot of people out there who actually have some form of flu but are not going to realize it because they have the vaccine, which weakened it, and so the full symptoms didn't manifest themselves, yet they could be spreading it because they don't realize they actually have it?
Yeah, I think, flu is transmissible mostly at the time when people are significantly symptomatic. And so, again, the protections are if you are ill, you should try to stay home, practice very good hand hygiene, and vaccinate yourself.
We had
Get
some parents tell
vaccinated.
us that they thought the school that had the most cases here should have closed because Christmas holiday, they're going to be let out in just a few days anyway. I know you don't run the school, you're the health department person isn't here, but do you have anything to say about a recommendation, or is the health
No,
department?
we'll leave that up to the health department. There's a lot of other factors involved with that issue as far as closing schools. But that the healthcare workers are prepared to treat or handle any eventuality that might arise out of this current flu season.
Doctor, every year we go through this, and when we grew up, there was the flu, we had colds, schools went about normalcy.
Sure.
Now suddenly you have these cameras here for a press conference about the flu, schools are thinking about closing. What's the difference between when we grew up and now? I mean, does the flu actually grow also? Is it constantly changing?
Remember, not everyone that's sick right now has the flu. I mean, there's the cold, there's the respiratory syncytial virus, the RSV that we see very prominent right now with children. So there are other types of pathogens that are out there, not just the flu. The flu is probably one of the worst strains because that's accompanied with muscle aches and high fevers and really makes people uncomfortable. And there is a significant morbidity associated and mortality associated with the flu. So we're a little more concerned about the flu, but it's been around for many years. Even when we were children, it was there. But like I said, today we're seeing an uptick of upper respiratory infections, URIs we call them, and a portion of those upper respiratory infections are the flu. And as you noticed, and as we talked about, we saw a slight uptick, but we usually see that at this time of year anyway, an increase in these flu-like symptoms. So, as Dr.
Not really much of a difference then?
It's not. We don't see a large increase. I don't have any exact numbers for you. You know any exact numbers? Yeah, I don't have any exact numbers that we have. What's the exact numbers on flu cases?
Right, they don't give you,
Yeah.
they just give you a activity
To have positive.
widespread.
Yeah. So the only things we got reported back were the ones that we have positive. Flu's come back positive, and those were 5 cases this week. So.
But why do you think, you said that you are seeing an uptick overall in upper respiratory viruses. Why do you think you're seeing that, considering the fact that it seems to me people are more cognizant than ever of washing their hands and trying to, stay away from others when they're sick, stay home from work. Why do you think we're still seeing the uptick?
Yeah, I think that's just the nature of the virus. Viruses themselves tend to change genetically, into genetic change with time, and we may not realize that we're covering that strain of viruses with our vaccine, and we're getting a pretty good coverage. We've got about 50% coverage right now, from what I understand from the current vaccine. And so those patients that aren't fully immunized to this current vaccine will come down with symptoms, and we're seeing more and more of that.
Well, I have one more. You said there was significant morbidity associated with the flu. We know people die every year from it. Who's at risk of it?
Yeah, mostly elderly populations and young. The elderly and the young, patients with other types of medical conditions like diabetes, hypertension, and asthma, chronic obstructive pulmonary diseases. That's why we recommend that patients, particularly the elderly, not only get the flu vaccines, but they also receive the pneumococcal vaccine as well to prevent pneumococcal pneumonia as well. So when you're older in age, or even younger children, or you have some other medical problems, you really need to take those extra steps to make sure you don't get sick.